Hi, welcome back to another video. Forward head posture, aka forward neck posture, is an extremely common postural deformity, affecting about 66% to 90% of the population. Forward head posture is typically associated with hyperkyphosis, but it can also happen independently. These type of posture can make one look unattractive and cause neck pain, upper back pain, along with tension headaches. I have in the past covered the corrective exercises for forward head posture, and I'm not going to go over those again today. This video is not just about fixing your forward head posture, typically focusing around strengthening your weak muscles with a view to improve muscular recruitment, so as to improve the position of the head. This can be achieved through drills like chin tucks or other retraction type workouts through upper back strengthening activities. But these exercises do not take into account of the root causes of forward head posture. That's what I want to get into in this video today, because forward head posture to me is not just about tight muscles trying to push your head forward. You need to ask yourself, why are those muscles tight in the first place? Why can't they let go to allow the head to become more stacked with the rest of the body? So watch till the end of this video and let's explore the root causes of forward head posture and the best way to fix this for good. If you like this video and find this useful, please click the like button. Please leave your comments below and share this video. Hit the notification bell so you won't miss any of my future weekly video release. Please also subscribe to this channel. This is completely free of charge, but will help the channel to grow. Thank you. You first need to ask yourself this question. How does forward head posture benefit your body? Well, when your head juts forward, it increases the upper airway dimensions. These postures also cause the mandible, that is your lower jaw, to fall backward or retrude. To be able to breathe, you have to open your mouth. This strategy helps you to pull in more air, but it comes with costs. First, impaired diaphragm use. Secondly, reduced lung volumes. Thirdly, limited neck and mandible mobility. This strategy happens if a person cannot get enough air through nasal breathing. The fix then is to improve airway dynamics. This will make nasal breathing occur more easily. If you can nasal breathe, you eliminate the need for forward head posture, and I will show you how this can be done later. So to eliminate the root cause of forward head posture, we need to be able to best manage an airway in a position that will open it in a way that will allow us to breathe to some degree of comfort. But our airway can be compensated for several different reasons. The first reason could be that we have a compressed rib cage. Our rib cage should expand in every direction with every single breath we take. So it should expand in the front, the back, and the sides. But let's say our rib cage cannot expand in the way we want to, because the ribs are in a depressed position. This is going to pull the head forward, thus allowing us to engage muscles on the front side of our neck, like the scalenes, to elevate our rib cage. Well, the scalenes muscles collectively act to elevate the first and second ribs, and in doing so, they increase the intrathoracic volume. These muscles should be helper muscles of inhalation. But if our diaphragm can't do its job because the ribs are too compressed or turned down, and they can't turn up very effectively, and thus oftentimes, these neck muscles, which should be secondary helpers, are now working as primary muscles of getting our ribs to elevate. And that's putting a lot of stress on them. And we are now creating a feedback loop. So the diaphragm doesn't work. So our head goes forward to help to give some leverage to elevate our rib cage. And then we can't use our diaphragm more. So it keeps going more and more forward to try to get more expansion that we are lacking. The other thing is that we could just have a small airway due to restrictions in some way, shape or form. And this is usually because we didn't have our jaw or our upper palate expanded enough. The reason for this is as we grow up, we probably have some degree of poor tongue posture and tongue function. The tongue has a key role in developing our upper jaw or maxilla, and also our lower jaw, our mandible. Every time when we swallow, we have the tongue pressed up against the roof of the mouth, and that happens thousands of times every day. When we're at rest, the tongue should be at the roof of the mouth, and that should give it a very gentle pressure as we go through our life. And as we grow up, the tongue pressure against the roof of the mouth helps to create expansion of the upper palate and moves the teeth away from each other as the teeth grow in. but also as we develop our cranial bones more and more, so this is allowing us then to open up the airway. But let's say that we have a tongue tie, for example. So we have tissues on the underside of the tongue that are pulling the tongue down all the time and restricting its ability to go up to the roof of the mouth. Well, tongue ties are far more common than you think. According to this research, tongue ties affect 4 to 10% of the population. So what has tongue tie got to do with forward head posture? Well, a fascial layer that is continuous with the tongue anchors to the base of the skull in front of the vertebrae. After enveloping the tongue, the fascia continues into the neck and down into the rib cage and below. The fascia anchors strongly onto the inner rib cage, organs of the rib cage, and the diaphragm. Well, the fascial tension usually has a certain amount of slack to allow for different movements. Tilting the head back as far as possible will tighten this fascial layer. Tongue ties bind up the fascial layer, increasing the tension on it. How tightly the fascial layer is bound up determines how much forward head posture is affected. Sometimes standing up straight is difficult, and in some cases impossible, because the person must overcome the fascial tension to stand up straight. As a result, you may have to deal with your tongue tie, possibly surgically, before any improvement in your forward head posture can take place. Let me give you another example. Many people get teeth extracted before they get their orthodontic braces to help make room for teeth to align better within the mouth. A common procedure for this is to extract the first 4 premolars, 2 from the maxilla and 2 from the mandible. This helps to create space for the crowded teeth to realign. But that over time, as the teeth come closer together, this is going to narrow your mouth and narrow your jaw and narrow your airway. Now you might need to revert to a compensatory mechanism to create more airway expansion. So, the cause of forward head posture is not just because of tight muscles. Yes, the muscles can be tight and are tight in many cases, but it is because they are secondarily tight due to an underlying root cause. I'm not saying that exercises such as chin tuck are entirely useless, but for most people, it may not be the solution for your forward head posture if you don't address the root causes in the first place. So, how should we fix our forward head posture? Well, with a forward head, there is reduced ribcage mobility. This limitation impacts how well you can move air. Accordingly, we need to restore the dynamics in the chest wall, which will help to improve anterior thoracic mobility. And this exercise is a really great way to teach your neck not to work in overdrive, but to use the diaphragm instead, which is the primary respiratory muscle. Now what we're going to do is to get into a 90-90 support position. Our feet don't necessarily need to touch the wall. Just a raised support will work, as long as you have around a 90-degree bend at both your knees and your hips. The purpose of this is just to make sure that your lower back stays relaxed and your back is not in an extended or arched position. We just want the rib cage to be down, nice and relaxed here. It is essential that we'll have a towel rolled underneath our neck, so that the curvature of our neck is being supported by the thickness of that towel, so that your chin is pointing directly at the ceiling, but it is not so much to where it is tipping your head back further than that, and it is not so small that your chin is dropping down. Now we're going to have 2 yoga blocks right here. You can use books instead if you don't have yoga blocks, as long as you get even height on both sides, about 4 to 5 inches. Because we're going to start the exercise by just getting our elbows directly out from our shoulders and then just letting them fall back and resting completely passively on these objects. If you need something a bit taller so that way you can stay relaxed, you can place your yoga blocks this way up, and that would be totally fine as well. And the purpose of this arrangement is to make sure that we can expand our rib cage without engaging our neck whatsoever. It is going to be pretty hard for some people. Let's try this together. Get a nice soft full exhale through your mouth with an open mouth like you're making an O. Do that for about 5 to 8-ish seconds. And at the end of the exhale, you're going to feel your rib cage come down a little bit. And you're going to feel a little bit of side ab engagement. I'm not talking about your 6-pack abs here, but your side abs, and you're going to maintain a slight bit of tension in those side abs as you close your mouth and put your tongue to the roof of your mouth. And inhale very silently through your nose. You will feel your chest rise a little bit, but again, never at the cost of you feeling your neck engaged. Because the goal of this is to educate our body how to use our diaphragm and breathe without our neck. You need to make sure that your neck stays relaxed. So the biggest problem you're going to have is feeling the front of your neck really want to kick in. So if that is the case, then you have to work on more shallow inhales and exhales. If you feel like when you start to inhale, your neck is going to kick in, stop the inhale before that point and then exhale again. If you need to move to strictly just nasal inhalation and exhalation, that is completely fine. Softer and longer breaths are always better than harder and more forceful. So how do you know you're using your neck when you breathe? First, obviously, you feel tension on the front side, but also the trapezius raising up like that. Now you're going to get some movement of the chest rising towards the ceiling and the rib cage as a whole, but it should be up, not necessarily shrugging vertically. Now we also want to make sure that your lower back stays flat on the ground, so that when you inhale, you should not lose that back flatness on the floor. And if you're arching your lower back, you may need to drag your heels down into the raised object a little bit, so that your hamstrings will kick on, and that will help you to keep your back more flat. And before I end this video today, I want to share with you a very simple tip that you can do anytime. That is going to help with your forward head posture. Try compressing your tongue up against the hard palate of your mouth. You're going to isolate specific muscles in the neck that are going to help you with your forward head posture. So take the second and third digits of your hand and put them on the upper part of your neck on both sides of your throat. I want you to take your tongue and push it against your hard palate, push it up against the roof of your mouth, push it up, relax and push it up again. While doing so, we're contracting muscles above and below the hyoid bone. And those muscles will naturally allow the head to start coming back into its normal position. Do it for like 15 to 20 seconds and that is going to kick in the nervous system to isolate those muscles. It feels very awkward because these muscles that are designed to bring your head backwards are going to work best when your head and your eyes are in that neutral position. So start doing this little exercise and you will start seeing a lot of progress in correcting that forward head posture. Until next week, take care. Thank you for watching until the end. If you like this video, please click the like button. Please leave your comments below and share this video. Hit the notification bell so you won't miss any of my future weekly video release. Please also subscribe to this channel. This is free of charge but will help the channel to grow. If you're interested in improving your health and fitness or losing weight, if you suffer from or wish to prevent back pain, please take a look at my book, which is now available from Amazon worldwide. Thank you.